Hey, this is a video response, sorry, to a tag that I saw, and I really wanted to, respond to it, hence the video response. The tag was, for mental illness, and, let me go back to the list of questions so I can answer them all. Hopefully the volume of the video won't start playing. Okay, there we go. Here we go, sorry for the delay. So it's a list of questions, and the first question is, what is your mental illness? I have been diagnosed with quite a few different mental illnesses. The first being I have avoidant personality disorder, and that is where a person has feelings of extreme sensitivity to like negative comments or evaluation, and can sometimes have avoidance of any kind of social anxiety, social interaction. I know with me, it's kind of like a ebb and flow kind of thing. There are times where I'm very standoffish, even with very close people. Times where it just can't happen. I can't socially interact. And then to also kind of like go with that, I've also been diagnosed with anorexia and also I guess it's a newer term called diabulimia. It's a diabetic eating disorder where we skip doses of our insulin because if your blood sugar is higher, you drop weight really quickly. And so with also, like most of you know, with eating disorders, you become very socially awkward, and very much kind of standoffish with any kind of social, I'm at a loss of words, any kind of social interaction. And so the next thing that I was diagnosed with was generalized anxiety disorder. I am like textbook when it comes to that. Worry about everyday things, and I mean, when I say everyday things, it's everything. Also, I was diagnosed with major depressive disorder, and I also have been diagnosed with obsessive compulsive disorder. And so the next question is, when were you diagnosed? I was diagnosed with major depressive disorder when I was 15. I'm 28 now. Luckily, I survived a suicide attempt, and so that is when the major depressive disorder was diagnosed, and recently the generalized anxiety disorder, the eating disorders, the OCD, and the avoidant personality disorders have been diagnosed within the last year. So the third question is, who knows about it? My parents know, but they don't know. And I say that because they know, but they don't want to know. They just don't want to know. They don't want to know about it. They don't want to know what's going on. So yeah, they just don't want to know. My boyfriend knows. My coven knows I'm Wiccan. And so that's where I get a lot of my support. Michael and my coven are like the most supportive people I know. And of course my therapist, my doctors, my nurses, of course, hello. And and a few other friends know, very close friends. Some of my friends know some things, that I'm going through things, but they don't necessarily know the extent of the things that I'm dealing with, or exactly what I'm dealing with. The next question is, what treatment have you had for it? I'm doing some behavioral therapy, just general therapy. I see my doctor, my nurses, and with the depression and the anxiety, I'm on oral medication, and that's about it. With the eating disorder, I have no treatment. As far as specialized treatment for eating disorders, there at my mental health facility, there's no one trained. We do not have anyone that specializes or has even had any kind of training for eating disorders. So I have some wonderful, beautiful friends that I've met here on YouTube, and that is my support, and that's my therapy for my ED, and that's about all I have for the eating disorder. The hardest part about living with a mental illness, I would say the hardest part, and I know a lot of people say the mental illness is the hardest part, and I don't know if it's the avoidant personality disorder or what, but the people that know make it hard, and I don't mean that in a bad way. They constantly challenge me, and what I'm saying is, by challenge, they challenge me to be better. I don't want them to think that I'm like, saying that what they do is a bad thing. I'm really appreciative of what they do, and they help me, and they make me better. And so that's the hardest thing is, and I know I've actually told a few people, coming out about a mental illness, to me seems harder than coming out. With a mental illness, there's all these taboo, stigma, kind of like, oh, you're crazy, you're gonna go psycho and kill us all. And I think that's also the avoidant personality and the OCD working in my head, that I'm constantly going, what are they thinking? Or when I tell someone new, what exactly did they think avoidant personality disorder is? Or what exactly did they think someone with an eating disorder is? And so that's the hardest thing for me, is worrying that people don't necessarily understand, and they act like they understand, but the way they understand it is not right. And so that is the part that stresses me out. And so the next question is, let's see, let me look. Something that surprised you about your illness or your recovery. These mental issues, and going to therapy and recovering, the thing that surprised me the most is that I have the balls to do it. There's so many people that deal with eating disorders or OCD or depression or whatever, and they never get help. They never get better. And not that I'm saying that I'm recovered, and not that I'm saying that I will not ever slip and be depressed or not eat or whatever, but the thing that surprises me the most is I'm a strong freaking person, and it takes strong people to admit that something's wrong, and it takes strong people to seek out help, no matter what. No matter, just telling someone I have an eating disorder, or I think there's something wrong, I need help. That takes some guts. And so the next question is, what is one false assumption about a particular disorder you want to correct? One thing that I do want to correct is, especially about eating disorders, is that anorexia or any kind of eating disorder is a girl's disease. And that's just not true. Eating disorders can happen to anyone. They can happen to someone that's big. They can happen to someone that's small. It's not gender specific. It's not orientation specific. You can be gay, straight, bi, black, white, beige. And so that's the thing that I want people to understand, is that eating disorders are not specific to a certain person. And then the last question is, what is one false assumption about mental illness you want to correct? And that would be, we're all people. We have a soul, we have feelings, we have emotions, and for someone to say that my disorder is not justified, or it's not true, or I should just get over it, they can kiss my ass. I have lived with these things all of my life, and I know that they are true, and I know that they are hard to get over. And for someone to say, well, you should just eat, or you need to get over that, or stop worrying. If you could walk a day in my shoes, you would never say that again. And so that's the one thing that I would like people to realize, is that people with mental illness, would you say that to someone that had cancer? How dare that person have cancer? It's an illness. They didn't choose to have cancer. My illness is an illness. I didn't choose to have these disorders. And so that's the thing that I would like to correct, and that's one thing that I'm striving to do, is trying to explain what mental illness is, and this is what I have. And so like I said, this was a tag video, and this is my response to the tag. So I hope that answers all your questions, and I hope you have a great day. Thanks.